Hello, and welcome to day 2 of using Optimal HRV. I am Dr. Ina Hazan, and today we will talk about breathing and practice a skill called low and slow breathing. This skill will be quite useful to you as you begin your HRV training. As you learn in the next few days, heart rate variability biofeedback training is done through breathing. So the first thing I want to do is make sure that you're breathing in the most optimal way. Let's start with dispelling the most common misconception about breathing. The idea that in order for us to feel calmer, we need to take a deep breath and get more oxygen. The reality is that at rest or with normal activity levels, assuming healthy lungs and a healthy heart, the air we breathe in contains about 21% oxygen, and the air we breathe out contains 15% oxygen. So we're only using about a quarter of the oxygen we take in. We do not need any more oxygen. What we do have to do is to conserve our carbon dioxide. The same carbon dioxide that is so often vilified as toxic or something we need to get rid of. In fact, that is simply not true. We need to retain about 85% of our carbon dioxide because without having sufficient CO2, the oxygen that we have gets stuck in the bloodstream and does not get released appropriately to the body and the brain. So strangely enough, in an effort to get more oxygen with overly deep but not slow enough breaths, you can have plenty of oxygen in your bloodstream and be oxygen deprived at the same time because that oxygen does not get to where it is actually needed. The easiest way to achieve optimal respiratory physiology and make sure that your oxygen gets distributed properly is to practice low and slow breathing. Here's how. Shift your breath to the belly, that's the low part. Slow down the rate of your breath, that's the slow part. And then take a normal-sized, comfortable breath through the nose as if you're smelling a flower. Then exhale slowly and fully through the nose or through pursed lips as if you're blowing out a candle. Allow your exhalation to extend longer than your inhalation, like this. Low and slow breathing allows all of your oxygen to get distributed throughout your body and brain, optimizing your respiratory physiology and optimizing your HRV training. If you're interested in learning more, check out optimalhrv.com for more resources.